Hi, this is Tom Goki with Orthopedic Educational Services. Our tips for today revolve around acute care splinting. I'll give you 4 tips that you can work on to help improve patient compliance and patient comfort. Our first tip is always pick the proper splint material. It doesn't make any difference whether it's plaster, fiberglass, or a pre-manufactured product. Always pick the appropriate product that will help your patient, that you feel comfortable using and has an adequate amount of padding. One of the things that you want to try to avoid is using splints to fit a need but not really to fit the injury. I have a splint here today that a patient came in to see me a few weeks ago, and the provider was rather ingenuitive as far as the splint material. They cut the splint to fit a small pediatric patient, but the one thing they failed to do is to take into consideration how long this patient might have been wearing the splint. And as you can see, the splint started to break down, the padding started to break down, and this patient ended up with a sore. So this may have not been the most appropriate choice of splints for long-term use. That takes me into our second tip of the day. Always make sure you have an adequate amount of padding. It doesn't make any difference whether you use a commercial product or some other type of splint material. Always ensure that the patient has an adequate amount of padding underneath of the splint. The padding will help to improve comfort, it will cut down on potential for pressure sores, and it will also reduce swelling and edema. Our third tip of the day is to make sure that when you put a splint on, you always assess the patient's sensation, motor function if possible, and also their pulses. Sometimes patients will have a change in their sensation or a change in their pulse because of the padding being too tight or the splint material being too tight, or they're just concerned about having to wear something that's a little bit more snug on the injured area. If there's any change whatsoever in the sensation, pulses, or movement, then make sure you assess that before the patient goes home. It's always easier to deal with the problem while the patient is in your presence as opposed to trying to answer questions over the phone or solve splint problems over the phone. Our last tip of the day is to make sure that when you send a patient home, you provide them some type of discharge instructions that are in writing. We all know telling a patient something is important, but sometimes the patients fail to remember everything that we say, not because we don't speak clearly, but because the patients have a lot of things going through their mind with an injury. So always give them some instructions about how to put ice on there, or limitations, any type of restrictions with wearing a splint, and also any medication orders or issues. And lastly, make sure you give a patient a callback phone number so that they can speak to a live person if they're having questions or problems. There's nothing more frustrating than getting recorded messages when you really do need to talk to a provider about your questions. Alright, so our question for the day is, what is an important component of acute care splinting? If you know that answer, go to our webpage, www.orthoedu.com, and fill out the comment section and send that back to us. For Orthopedic Educational Services, I'm Tom Goki. Have a great PA week.